One of the most important things with this obesity epidemic is we're also seeing an increase in type 2 diabetes, which has nothing to do with insulin. Right? With a type 1 diabetic who is insulin, dependent, if you ever see those insulin diabetic patients, they're very skinny. Why? Because they can't absorb the sugar into their muscles. However, with a type 2 diabetic, their fat cells are very much engorged. They have more insulin circulating around. It just isn't working because they have resistance to it. So you need to use other drugs to offset that are going to control the sugar and not only control sugar metabolism, but also help in reducing that appetite. That's where a drug like semaglutide comes in, because it will decrease appetite cravings, but also
alcohol cravings. Have you noticed?
Yeah.
All of our patients are saying that.
Yeah, they don't. Well, again, what happens with alcohol? It just converts into sugar. So, and the other good thing about a semaglutide with helping is that you don't have as much of a risk of hypoglycemia as you do with, say, something like insulin or sulfonylurea, like metformin, something like that.
Okay, I didn't realize that. Now, what have you seen in your experience with the patients you're prescribing semaglutide versus tirzepatide? Are you using that in your practice as well?
I haven't started using tirzepatide.
Okay.
But the semaglutide, I would say for a good portion of patients, it works very well. I have several that have been on it for years, lost 30, 40 pounds, look great. They can exercise more effectively. One of the other things that we have to worry about also with the obesity epidemic here is some of the more concerning metabolic derangements that we're seeing, like fatty liver disease.
Yep. Even non-alcoholic fatty liver disease is becoming more common now, which is very strange.
NASH, non-alcoholic steatorrhea, hepatitis. There are some concerns that now that we have treatment for both hepatitis B and C, which are the chronic hepatitis, eventually NASH is going to become the leading cause of liver failure in the United States.